So how are we supposed to stay the superpower when we don't invest in breakthrough science and research? And I have to tell you, I never thought I would run for office. I'm running because we're in the US and we don't have a good healthcare system and we have to fix it now. It should be easy for us and we shouldn't go into debt if we need care. Like, why are drug prices so high? So these are the things I'm going to work on first. And I have a track record of actually fixing things, starting with in New Jersey. We now have an administration that is very pro-hate. I'm Dr. Tina Shah, and I'm running for Congress in New Jersey's 7th District.
Can you tell us why you're running for this seat? And when did you decide to run?
Well, I'm a practicing doctor. I'm actually triple boarded in internal medicine, in pulmonary, and in ICU. And I have to tell you, I never thought I would run for office, but every time I practice, I see somebody coming in because they couldn't afford their medicines, or the insurance company denied that MRI that they needed. And that's why I'm running. I'm running because we're in the US and we don't have a good healthcare system and we have to fix it now.
You worked in Obama's White House, right?
I did.
And then with Vivek Murthy.
I did.
What kind of fix you need to do in the healthcare system?
Well, I think healthcare has really shifted away from the actual people. When I get sick, when you get sick, it should be easy for us and we shouldn't go into debt if we need care. And what's happening right now is that we have a Congress that is just cutting healthcare in every single way. First, they cut Medicaid, so people that are the most vulnerable, they don't have health insurance starting this year. Also, people that buy insurance on Obamacare or the exchange, they've lost their premium subsidies, their tax credits. So now they can't afford health insurance. And nobody has been holding other stakeholders in check. Like, why are drug prices so high? And why are insurance companies so easily able to deny care when you and your doctor decide you need it? So these are the things I'm going to work on first. And I have a track record of actually fixing things, starting with in New Jersey.
Can you tell us about that?
I would love to, yeah. So I want to tell you a story. And this is it's a sad one, but I saw a patient the other day who has had asthma, but she's been fine for 10 years. And what she told me is that she shifted insurance companies. Then all of a sudden, her inhalers, they required pre-approval. So she submitted the pre-approval. Then they got denied. Then she ran out of the inhalers. She couldn't afford to pay for it out of pocket. And she showed up so sick, she came in the ICU on a ventilator. And I'm thinking to myself, this shouldn't happen. And that's what I worked on in New Jersey. So there were two amazing legislators, Senator Vin Gopal, who's also Indian, and Herb Conaway, who is a physician now in Congress. Mm-hmm. And they had a bill to stop insurance companies that are regulated by New Jersey state from just denying medicine like this. And so I created a grassroots movement. We got patients, we got doctors, we got nurses together. And all of a sudden we wrote so many letters that the insurance companies actually had to listen, and then this bill passed. And so now if you have insurance in New Jersey that the state regulates, you will actually not have this situation where essential care gets denied. But we need to do that everywhere.
And what's your vision of a healthcare system in the US? What are changes you want to bring when you go to the Congress?
Well, I think about how all of us are buying goods on Amazon or on Walmart, and it's so smooth. You can open your phone, you can click on something, you can read reviews. And why isn't healthcare feeling more smooth like that? So my first thing is to make sure that people that have lost healthcare because of my member of Congress, Tom Kean Jr., and because of Trump's policies, that we at least restore healthcare. And after that, we need to make sure that we don't keep the same system because it's already breaking down, but we have to enhance it. So I want to make sure that you can actually get healthcare that keeps you healthy, not just sick, and also care that feels as smooth as buying something online.
How do you view President Trump's healthcare policies?
He has no concrete policy except to dismantle the things that are working. Here's what he's done. He's taken scientific experts and he's kicked them out of the government. And we see that because he's kicked out experts from the CDC. So we have no idea when the next pandemic is going to happen. He also, and this is really under RFK, a person that he appointed, RFK Jr., kicked out the vaccine experts on the vaccine board. And we know in the last month that children are now going to suffer because hepatitis B, which is something you usually get as soon as you're born, is now not recommended. It's optional. Now, I'm a doctor, and hepatitis B is something that we should never see. It's something that we can cure and we can treat. But what's going to happen now is that people are going to get this disease, which is life-threatening, when we could have prevented it. So he's deciding that science is not real, and he's kicking out the experts. He also cut life-saving medical treatment dollars, or medical research dollars. I can't believe we have the most powerful research institutions in the world, and he just cut funding for NIH. So how are we supposed to stay the superpower when we don't invest in breakthrough science and research?
But you also work with pharma companies to bring down the cost of medicines.
He did, but he did it in a select few. So if you look at what he's doing now, and you look at the list, and I'll tell you, there's one medicine on the list that fits with pulmonology, and it's for pulmonary fibrosis. And he's negotiated that drug price to within thousands. Now, a cost of a medicine that's still more than $1,000 a month is still too much. So every president tries to do some good. But why are you focusing on something that affects such a few number of people instead of going after the big medicines, the big pharma? And on top of that, the chaos that the Trump administration has created because of the tariffs, one day, who knows, your medicine might be this price. Another day, the tariff might change. Your medicine might be that price. What's happening to my patients is that they're waiting. They're like, I don't know, should I buy the medicine now or should I wait? I mean, the chaos is causing people to actually have bad medical care.
I'd like to know about you and your family's immigration story.
Yeah. So my parents grew up in Gujarat, in Ahmedabad, and my mom came over in the 70s, and my dad actually came to Canada to do a master's, and then they met and got married. And I think they have this beautiful story that many of us have when we're second generation. Our parents came here for opportunity, and they put everything they had in me and my brother. And I have to tell you, I went to the best public school in the world. I had so many opportunities. That's why I even dreamed and then became a doctor. And one of the best parts about being Indian is that our community is so strong and we lift each other up. And I will tell you, that's the reason why not only did I become a successful doctor, not only did I work for Obama, but that's why I can even dream and now be the front runner in my race for US Congress. And when I'm elected, I'm going to be the first Indian to ever represent New Jersey.
Yeah, we have in New Jersey has a significantly large number of Indian Americans, but they haven't elected an Indian to the Congress yet.
Right, right.
Right.
But our culture is just growing. I mean, we have amazing business people, amazing engineers, every single thing, lawyers. And now it's time that we have representation, because I look at what happened with the H-1B visa issue, and that was heavily targeted towards our Indian community. We need to make sure we have loud voices in Congress to represent the challenges we have.
The last year or last few years, we have seen increasingly attacks on hate crimes on Indians, Indian Americans,
Yeah,
places of religious worship.
yeah.
What are your thoughts on that? How you are going to address that?
There's no place for hate like that. It's unbelievable that this Trump administration is allowing this to happen. And whether it is something that we are seeing even in the Indian population, in our community, of people legally here in the US that are getting picked up by ICE, to being racially discriminated in other ways, we now have an administration that is very pro-hate. This administration is trying to take one person and put them against the other person. That is completely against our values. And I will do my best to continue to be, I'll tell you this, as a doctor, I don't get to choose my patient. I don't care what race they are, what their political leaning is. They're all my patients. And that's the same mentality I'm going to bring. But we have to bring to surface what the Trump administration is doing. Every single person that is here in the country, they they deserve justice and due process. And I'm just as American as everyone else here. So I deserve the same rights, and I think our entire community does.
Congress plays an important role in shaping countries' foreign policy, national security.
Mm-hmm.
In that role, how do you see, if you're elected, how do you play a role in India-US relationship?
Well, I think it's so hard to know what our relationship is going to be when we get to 2027, which is when I'll be elected. But what's clear right now is that Trump, as a administration, the Trump administration has some of the weakest foreign policy by kicking out experts, by not having clear cut, consistent policy. And my seat, New Jersey 7, is one of 3 seats needed to flip the House. So when I flip this seat and we flip the House and it goes under the control of the Democrats, we will finally return the checks and balances that are needed for the Trump administration, particularly in foreign policy. And that's where we're going to start. I mean, we have an irrational president when it comes to foreign policy.
Coming to a campaign, how do you balance between your work and the campaign? How you're doing it?
I will tell you, I'm very fired up to do this job. And I mean, you know this. When you're Indian, all you do is work hard. That's our baseline. So I will say that I have an amazing extended family and immediate family that supports me. And it really feels like a privilege to still practice as a doctor and run for Congress because it keeps it so real. Every day I'm practicing, I talk to people in my district and I understand their challenges. And right now, they are sometimes deciding between paying their rent or paying their medical bills. And this is unbelievable. So I can't wait to do the work. I can't wait to go to Congress because we have people that are hurting. And as a doctor, I'm ready to help them.
In the 7th Congressional District, who do you think are your main challenges, competitions from?
I think the main challenge is that we have a sitting member of Congress, Tom Kean Jr., who has a name and he is riding off the name of his family in politics. The only thing he's done is been a politician for his entire career. And we're finally calling him out to say, look, you actually keep talking about lowering healthcare costs, lowering energy costs, lowering our taxes, but in fact, you've done none of these things. Mm-hmm. But he is my challenge. We have a guy who thinks that it's okay to not meet with his constituents, and I don't think so. And I'm calling him out, and I'm going to beat him.
Any last concluding remarks that you have?
Well, when I think about our community, and I think about how our goals as an Indian community is to give our kids the next best opportunity, what I know now is that we are really, really on the cusp of doing something amazing in the US. We've built businesses. We've become deans of colleges. We have done things above and beyond. But the next big piece for us is actually seva. And in addition to that, in the form of philanthropy and in the form of doing this at the temple, going into politics and thinking about bringing our principles from our community and doing it in a larger scale is something I'm really excited about. But you know what's even really, really exciting? If I'm running for Congress today, what are our kids going to do after this? Who's going to become president? Who's going to become a senator? And this is what we need. We want to see that our community thrives in every single place.
I wanted to ask you one more question.
Yeah.
When do you inform your family members, your parents in particular, what was the reaction?
They were shocked because their daughter finally became a doctor and they thought, okay, she got it, But as we continued to talk, my parents particularly started to see that this is the opportunity to make impact at a scale that none of us have ever dreamed of in our life. My parents, when they came to the US, first they wanted to be stable. They wanted stable jobs. Then they wanted to raise their kids in a safe place. And then they wanted their kids to get the best education. But this is like, the next level of what can you even dream about for your kids. So I'll tell you, my parents are probably the loudest champions I have now. And they are in India for this time period because it's cold in the US. And they're calling me every day with campaign advice, with tips, with connections. I mean, this is the time. Can you imagine Right now, we have a Congress that has 535 people in it, but only 6 are Indian. And that is not representing the number of people here, the impact we have in business and in other places, and we need to fix that issue.
And of the six, only one is a woman, right?
That is correct.
We need
Yeah.
more women.
We do. Yeah, we do.
You face challenges when you go out for campaigning as a woman.
I mean, I think everyone has challenges based off of what box someone tries to put you in. But what I can tell you is this. Everyone has a healthcare story of when they needed something and the system failed them. And that's usually where I start because I have that healthcare story as a patient and as a doctor, but everyone that I'm talking to has it too. And all of a sudden we have some common ground and that's where we start.